Assalamualaikum and good day to everyone. First of all, it's a great pleasure to get this opportunity to present our research at the International E-Conference on Applied Sciences, Society and Economic 2021. So let me introduce myself. My name is Nurfatin Natasya Syatira Binti Najib from the Center for Media and Information Warfare Studies, Universiti Teknologi UiTM Shah Alam Selangor. I'm going to present a research entitled The Relationship Between Social Media Panic of COVID-19 and Facebook User Psychological State. The co-researchers for this study are Dr. Suhaimi bin Sa'aha Lion Sabah, Nurul Atikah binti Muhammad Azlan, me, myself, and Nur Imanina Aisyah binti Suhaimi. So first of all, I will start my presentation with the research background. After the emergence of the novel coronavirus, the COVID-19 outbreak began in China, many news, information, conspiracy theories, and even misleading rumors have started to spread actively, especially through social media that has created panic, racism, and fear among the people around the world. According to Chua 2020, a lot of fake news and misinformation has been spread and caused anxiety and uncertainty among people, especially during the starting of the movement restriction order that has created panic to the society. All the information disseminated through social media will give an impact on society decision and their thinking, which could give benefit to the other as well as create fear for them in fighting the coronavirus. Therefore, it is important to study the relationship between social media panic of COVID-19 and Facebook user psychological state. For the problem statement, media reporting through social media plays an important role to shape the direction and influence the audience on handling their best behavior through the movement restriction order. Since the spread of the news on coronavirus, the sources on the news combined with fear-mongering, bigotry, and widespread buying of face masks, both strongly related to the new 21st century infomedia environment labeled by the social media. The connection of virology and virality is a striking aspect of the crisis. Not only did the virus itself propagate very quickly, but also the knowledge and confusion about the pandemic and hence the fear it generated in the population. Previously, the social media user did not prepare themselves with enough information and knowledge about COVID-19, so they easily got panic and anxious whenever they read the posting linked to COVID-19 on social media. But after a few months of battling with the pandemic, they started to find out the correct information on the news received before sharing with other people on social media. The research objective for this study is to identify the psychological symptom of the social media panic to Facebook users, to determine the cause of social media panic during the COVID-19 outbreak among Facebook users, and the last one is to study the impact of social media panic on COVID-19 in shaping the Facebook user psychological state when dealing with the crisis. For the literature review, the first one is on the social media panic during COVID-19 outbreak. Communication activities on the social media platform have expanded rapidly, and in addition to its usual social networking role, it has expanded an avenue to raise awareness of COVID-19, to monitor the outbreak of panic, and to disseminate information or measures to be taken to curb the spread. According to Yagnik and Chandra in 2020, people not only exchange knowledge through this channel, but they also pass on their feelings, emotions, and fear to a wide number of people. This information and false news circulated by the newsmonger were not limited to COVID-19 or similar line, but a sure success on the road to generating gaps between cultures and nations. According to Barsad in 2020, he demonstrated how this whole flood of data emerging from negative emotional contagion, which is a change of mood between people, can somehow produce more infections positive emotion. According to Brewer in 2020, anxiety triggered by social conditioning creates a sense of panic where everybody has a rationale for the anxiety they feel from rumors. At the moment of the public health crisis, hoaxes and false news are focuses on unverified evidence and knowledge that cause panic and anxiety among people. For the second literature review on the social media panic and psychological state, previous research has shown that confusion and uncontrollable emotion were strongly linked to tension and distress during the H1N1 outbreak. Therefore, individuals regularly participate in information seeking to minimize confusion in a crisis situation from a range of outlets so as to relieve their nervous feelings. According to Ken in 2020, social media provided everyone with the opportunity to share data with everyone else, which is why as soon as they knew something about COVID-19, they started to post on social media. Besides, it is recognized that posting misleading information about the dissemination of disease on social media platforms will have a negative effect on public health and the mental health of individuals. It can be seen that these days, the social media users are expert as they try to share their opinion and thoughts about COVID-19 to the other digital platform users. According to Garrett, the pandemic itself gives social media the ability to produce fear of COVID-19 when most of the social media users post panic-inducing data and it spread thought. For the theoretical framework, to understand the concerns of the public toward the spread of disease, the model of public perception of risk has become as important as the model of physical hazard. In many events, physical development is usually linked with the perception of risk, and this belief determines the effect of an alarming event on one's behavior and reaction, which will lead to their level of exposure to the crisis. Social amplification of risk framework explains that society usually undergoes social processes as they experience uncertainties or anxiety when they are facing an alarming event such as in crisis. This resulted in unexpected behaviors such as panic, protest, exaggeration, and other behaviors that are caused by public risk perception. According to Busby in 2003, during a crisis, the social media user will receive a lot of different news and information regarding COVID-19, which resulted in different perception and argument came from them that would include disagreement, uncertainties, and believing towards the knowledge. Such cases where different people have different risk perception could be amplifying a risk during the crisis and lead to a different reaction from the other people who get influenced by different information received by them. The mechanism of amplification begins with either a real incident such as physical event or the diagnosis of an adverse consequence such as the discovery of vaccine. In both cases, people or society pick and perceive particular element of this event or aspect of the study result according to their experiences and mental processes. In this study, the process will begin with the physical event, which is the COVID-19 pandemic, and the public will use social media platforms to gather the information related to the pandemic. The posting on the physical event may create panic and fear that may influence the psychological state of the society when facing the hazard interchange. For the research methodology, the study is conducted in Petaling district area and the total population of the people in Petaling district Selangor is 1 million people. Therefore, according to Craigie and Morgan sample size and population table, the sample size for the study should be 384 people. The method of data collection for this quantitative analysis is through the use of surveys, and the data obtained was analyzed by using SPSS software. For the research finding, the questionnaire for the study were distributed across the digital platform via Google Form, and it focuses to the respondents who live around Klang Valley and have a Facebook account. From the data collected, there are a total of 241 of female respondents and 145 from the total respondent are male respondents, which shows that female respondents are higher compared to the male respondent. This analysis shows that the highest races who answered the survey is from Malay group with a total of 314 respondents, followed by Chinese and Indian. Majority age group of the respondents are from the age group 21 to 25 years old with a total of 160 respondents. On the occupation section, majority of respondents are working in the private sector with 150 respondents, followed by respondent who is student with 139 respondents. So from the analysis, it shows that majority of respondents with 165 respondents spend their time with an average of 4 to 6 hours daily on their social media. So now we move on to the finding and discussion. So the first one is on the relationship between psychological symptom and social media panic. From the information that they receive, the psychological state of the respondent can easily influence their public perception, such as the factor of trust, awareness, uncertainty, and personal impact, and trigger their social media panic when reading such news on the death of people who were affected by the virus, and also by the announcement of the movement control order that caused insecurity. The psychological symptoms such as awareness and confuse triggers the social media panic among the Facebook user by influencing the way they could understand and follow the standard operation procedure implemented by the government. With the misinformation and different posting on the latest standard operation procedure shared across Facebook, it caused confusion among the Facebook users. Therefore, individuals regularly participate in information seeking to minimize confusion in a crisis situation from a range of outlets so as to relieve their nervous feelings. The second discussion is on the relationship between social media panic and Facebook user psychological state. So from the information dissemination, the Facebook user find themselves distressed by reading the stories and situation on Facebook and triggered their psychological state. According to Can 2020, social media provided everyone with the opportunity to share data with everyone else, which they choose to share their uncertainties across the digital platform that can cause social media panic. However, it can be seen that the respondent is experiencing a low level of anxiety, where the public risk perception does not really influence the psychological behavior, as most of them spend most of their time doing research on the reliable sources of COVID-19. Despite being worried on the number of cases that fluctuate, the respondent does not experience sleeping difficulty and anxiety, although they are stressed on the government decision to extend the movement control order. This is because, for the past few months since this crisis started, the respondent has started to have the self-awareness and they are able to cope with the new way of life during this crisis. So, in conclusion, when a lot of news and posting related to COVID-19 shared across the digital platform, it may trigger the social media panic to feel panic and anxious about the pandemic. However, with the increase of time spent on social media caused by the announcement of movement control order, the users get to have more time to learn more and gather much information on the crisis. This could help them to decrease the media effect of social media panic, which also can help to reduce their negative psychological state during crisis. Even though with the fluctuation number of daily cases, it can be seen that the society are becoming more aware on the current situation, including the standard operating procedure and the right source of news that they receive on social media. This has resulted in less panic and uncertainties on every announcement made by the government, including the extension of movement control order. This result may help policymakers to manage panic among society due to the COVID-19 outbreak and also to reduce the negative psychological trait among the social media users. So that's all from me. Thank you.